Right ankle, next field. 55-year-old male with a history of an injury, comma, complaining of swelling in the ankle, comma, loss of range of motion with instability, period. Next field. None, period. Next field. Standardized fat and water weighted pulse sequences were obtained in all three orthogonal planes, period. Next field. There is non-displaced fracture of the posterior malleolus, comma, which is oriented in the long axis of the tibia, period. The fracture extends into the posterior lateral articular surface of the tibiotalar articulation, comma, without cortical offset, period. There is lateral extension of the fracture into the distal tibiotalar articulation, open paren, sagittal stir series 4, comma, image 12, semicolon, axial proton density series 2, comma, image 27, semicolon, axial T2 series 2, comma, image 28, close paren, period. Normal talar dome, comma, without a demonstrated osteochondral injury, period. There is a moderate volume joint effusion of the tibiotalar articulation with anterior and posterior capsular prolapse, period. New paragraph. There is a complete rupture of the anterior tibiofibular ligament of the distal tibiofibular syndesmosis, open paren, axial proton density series 2, comma, image 27, semicolon, axial T2 series 2, comma, image 28, semicolon, coronal stir series 5, comma, image 19, close paren, period. The posterior tibiofibula ligament remains intact, period. New paragraph. Insert normal ATFL block text. New paragraph. Insert variable field block text for ankle. Next field. Normal. Next field. Normal. Next field. Normal. Next field. Normal. Select the Achilles tendon. Next field. Abnormal. Next field. Evident. Next field. With tendinosis and an apparent tendon tear. Period. New paragraph. The plantar fascia has been excluded from the field of view on this examination, comma, and cannot be evaluated, period. Next field. Non-displaced intra-articular fracture of the posterior malleolus, period. New paragraph. Complete rupture of the anterior tibiofibular ligament of the distal tibiofibular syndesmosis, period. New paragraph. Tibiotalar joint effusion with capsular prolapse, period. New paragraph. Normal talar dome, period. New paragraph. Slight tendinous abnormality and an apparent tendon tear, period.